right?
Yep. Office of Community Response.
Okay, so maybe you just saw that. I'm here today. This is Jay Schenirer, District 5 City Council, and it's our weekly Facebook Live. I'm here today with Bridgette Dean, who is the Interim Director of the Office of Community Response. We're going to get to Bridgette in just a second. A very quick update. We did not have a council meeting last night, although we did have a Law and Legislation Committee meeting, which I think had two very important issues. The first one was a 2-hour workshop with our folks who are working on equity issues, and it's called Race Forward. And we have been working with them for about 18 months, developing tools for the city to be able to use as we look at equity in our workforce, equity in who we deal with, and equity within the community itself. So it's a good starting point, and there will be a working group of council members and staff and community members to continue this work moving forward. The other thing we did was we passed a resolution that is about public safety and redefines public safety. Generally, people think of police and fire, response time for fire, and number of police per thousand for police. What we want to do is really expand that definition to think about safe communities and what prevention activities we need to do, particularly for young people, so that we don't get into the situations where we need intervention. And that's going to lead in a lot, I think, to what we talk about with Bridgette today. So as we always do, let me ask Bridgette to do a quick 3-minute or 4-minute bio of herself so we know where she came from. And then we're going to get into this new department and what it does and why the heck we're doing it. Bridgette?
Perfect. Great. Well, thanks. Thank you, Jay, for having me today. So let's give you everybody a little bit of background about who I am. My name is Bridgette Dean, and I am currently the interim director of the Office of Community Response here in Sacramento. And that is a new department that we'll talk a little bit more of shortly, but just a little background about me. I always share that I am I grew up in Nevada, and I'm one of 9 children. So I myself grew up in poverty, and when I was 16, my father passed and I raised my siblings. So I share really openly that I actually I was a high school dropout, and I ended up taking my GED and then raising my younger siblings. I was a teen mom. I'm a mother of 3 children. I raised 3 children. They're all in their late 20s and 30s now, but 2 of my children, I had one at 18, one at 19. And my last child when I was about 25. But as a mother who had been a single mother and had that experience, that shaped who I am today and where I ended up going in my career. As an adult, I ended up returning. I graduated from high school, from adult high school. And then I went on to get my degrees in social sciences, social work, and a master's degree in social work. And today I'm a licensed clinical social worker. But my job career that got me here has been an extremely blessed but varied experience. And I'm grateful for it because I think it prepared me to do what we're doing right now in the city of Sacramento. So after I graduated with my master's degree, I actually went into school social work, and I started doing school social work. I ended up being an administrator, and I oversaw a continuation high school for 12 years. And so I worked with a lot of population and youth and families that were in need, crisis, and disenfranchised. And a real passion for me. And to this day, I love nothing more than working with our youth and our communities. It still makes my day every day. I had an opportunity several years ago in the city of Roseville to start the first social services unit in law enforcement in the region. And to date that I know of, I always tell people, if you meet a cohort out there that has had that experience of being a social worker and overseeing sworn units, to call me, because it's an interesting cultural experience, to say the least, for professional aspect. But I created the first social services unit. And as a social worker, I oversaw sworn units that responded to mental health and homeless related calls for service and youth. And I oversaw school resource officers and youth programming. About a year and a half ago, in May of 2019, there was a position that opened here in the city of Sacramento. So I did apply for that. That was at Sacramento PD, where I also oversaw the mental health unit and the homeless response team and the hospital units. Now, all that leads me up to this point today, Jay, where in July, I was I was appointed as the interim director of the Office of Community Response. And the goal of that department is going to be that, that idea of, to your point, public safety. What defines public safety? Who responds to people who are in crisis and need? And how do we better serve our communities? That doesn't always mean law enforcement or fire.
No, that's great. I think here's the most important question. Were you the oldest of 9 or?
No, no, I am right in the middle. I have 4 ahead of me and 4 younger than me. And it was my 4 younger siblings that I ended up raising. And, but no, I'm a middle child. So anybody keeping track of where they are in their families and you connect to that, you know what I'm talking about.
Right. Well, we're excited to have you. So let me see if I can provide a little bit of context around the department, and then talk to me about how it's going and what you're trying to achieve. Certainly, there's been turmoil in our city, as in the entire country, about the role of police and the role of that plays with mental health and domestic violence, all of those types of things that we know we need to deal with on a daily basis in the city. Certainly, there were calls to defund the police. I think what Sacramento has done has tried to be thoughtful in how we look at the services that are currently being provided by both police and fire and our emergency services, and really asking the question about what should they be doing. I've always thought about, as I've talked to our local officers, they didn't really sign up to deal with homelessness. They didn't sign up maybe to deal with domestic violence or mental health issues. And are they the best equipped? So are we putting people in situations where they may fail? And I think that's a responsibility that we as leaders have to really ask that question and come back with solutions. Like other cities in the country, the scenario that we put forward and that the mayor put forward was, let's look at those positions. Let's look at what the police and fire do and ask that hard question of, should they be doing it, or is there a better way to do it? And how do we get the best results for the residents of Sacramento? So what the mayor put forward, which the council has approved, is to create this Office of Community Response, to put $5 million as starter money. I think we do want to have a longer conversation about the money going into the police department and the fire department, and if we're going to take responsibilities away, do we shift those funds over as well? So that's a conversation that I hope that we'll be having within the next 6 months or so. But a lot of work to be done there. Historically, just as one last bit, and then Bridgette, I want to turn it back over to you. The city has not been a social service agency. When I started on the council 10 years ago, we weren't doing anything with homelessness. We certainly weren't doing anything on a larger scale with young people's mental health, working with the schools and things like that. But we've taken on a lot of that responsibility, because to be a successful city, we need a healthy community, and the health of our community, broadly includes all of those aspects that we've been talking about. So I'm very proud of the city for taking that on. We don't have specific funding streams for that, but we've said as a council, it's such a priority that we need to spend our general fund money, and since then have gone out looking for private dollars, state and federal dollars as well. So the end result of that was the creation of this department. So maybe you can take it from there. And I think, you were appointed by Howard Chan, our city manager. I think he made a great choice with you, given your background especially. Mm-hmm. So tell me what you're doing and how is this going to roll out for us?
So I want to start off by letting you know that for me, the Office of Community Response, and what we should be talking about when we talk about all of those structures of first responders, is in my role in law enforcement and working with youth and families for so many years and within the homeless community. It's apparent that we have a lot of people on the front line who are doing tasks, to your point, Jay, who weren't trained, nor did they sign up for that. I'm a social worker. I've never been sworn, but I've overseen sworn officers. I have a different kind of training behind me, right? And a different experience. So when we have police departments, especially, I think being asked to respond to calls for service, and I think it's crucial to point this out. In the city of Sacramento, on average, the police department gets almost 4,000 calls a month from community members calling and asking for response to a homeless encampment or homeless individual. And when we're starting to talk about calls for service, we have to not only make the point, but we have to own as a community that we've become extremely dependent on first responders like the police department to take those calls. And so that is our 911 24/7 crisis line, whether it's mental health, homelessness, or some other issues. We don't have a lot of systems in place that allow for somebody in crisis to call somebody else at 2 o'clock in the morning. And so one of the things I think that's crucial about this department is we have to look at it as the third part of the first response triangle. I always tell people we got a triangle going on, right? It's got to be a fluid working model between police, fire, and Office of Community Response. Why? Because sometimes things escalate for safety purposes and you might need that training of a law enforcement officer. Some things are medical and you might need that fire there or paramedic available. And so that ability to work together, I think, is essential. As far as the department, the goal is to have a social work response model that will take not second or third response, but first response to calls for service. And I think this is the key. When you look at a lot of national programs right now that different states and cities are using, they're all programs and they're good programs. We talk about a Cahoots or some of these other programs, and they're good and they support their communities, but they're often either they might respond or they're a follow-up response model. And in the city of Sacramento, when I came to the police department, we created a response model for mental health where we did a warm handoff to a social work team to follow up with somebody who had made contact with law enforcement by themselves, like they've called, or a family member, to get them services. Now, the key to what we're doing in Sacramento is I believe is a national model opportunity where we are saying, let's create a department and teams that actually are first response. So when you call into that dispatch center and you say, I want this type of response, there's at least that ability to get that there. And when we're talking about social workers in particular, or therapists or whatever, and we talk a lot about mental health, but looking at calls for service, and in my experience, family disturbances, a lot of our youth having experiences where they might come into contact with law enforcement, especially, that really could be handled by a community response team versus law enforcement, right? I worked in schools for years. The school to prison pipeline is real. And we need to be talking about how do we cut that off, right? And the way we cut that off often is getting that support to that youth in a different fashion. Family disturbances, the follow-up of a domestic violence situation where that victim can get support services, as well as, frankly, the perpetrator if needed, right? So that they don't continue to perpetrate. So I think overall as a city, what we're looking at is this idea of a first response model that can respond to calls for service 24/7, 365. But part of that is not only hiring staff, and I want to stress to people in the community, we have to incorporate and fully collaborate with our community-based organizations. We have so many experts in our communities that we don't coordinate with or work with. And we really have to get them bought in. If we have young individuals who have a connection to an Impact SAC or another program in our community, we need to be using that program, right? Because they already have the trust and rapport with them. So I think that we could do a lot of great things in this department as we're working through it. I mean, I have hope that I have hope, but I also have the drive to make sure that we're really shifting. And if I'm calling, I share openly, I have family members who have been justice involved, and I have mental health in my family. And I want those individuals to be able to call who they feel is right for them to get the best support they need in the time of crisis.
So, Bridgette, could you give us a little bit of context? You said that 4,000 calls a month to the police around homelessness, mm-hmm. which I totally believe in. I have a lot in my district. And I have to tell you, it's the hardest thing for me about being a council member are all of the calls, emails, and texts I get about homeless encampments. Excuse me, because I have so little ability to do anything about it mm-hmm. at this point. Right. And it's just a feeling of helplessness and sometimes hopelessness, which I know we have to turn around. But 4,000 calls on that, what's the context of that? How many calls do the police get in a month? So what percentage are we talking about? And I don't know if you have those numbers.
I don't off the top of my head. Yeah. It is fairly, I can send it to you for you to post if you would like.
Just give me a ballpark.
It's fairly significant. Between mental health and homelessness, I think almost a month, about 10% of our calls for service. Right. And so when you start talking about what the need is, to your point, the hopelessness and helplessness, right? One of the goals of this department is to coordinate those service providers and have individuals working together to do the best response possible. Homelessness, right. We have to talk about infrastructure, right? So I can send out, somebody can go out and feed somebody who's experiencing homelessness right now, but it doesn't necessarily mean they're going to necessarily get off the street today. But I do think that when it comes to encampments and some of those issues, having a social work model with case management and a solid collaborative framework where we work with everybody, our housing providers, our substance use disorder providers, a lot of our other provisions that we often don't bring to the table because we're so siloed at times. And that's not just the city. Our providers are often siloed. The county and the city can be siloed. So having those open formats where we're really creating fully holistic collaborative response teams, even if I'm experiencing homeless, having that regular case management or contact 2, 3, 4, 5 times a week will actually might help me get to the point where I need to be ready to be housed.
Right. So we've thus far moved 2 groups of folks into your department.
Yep.
Those who work with homelessness, and then also our violence prevention folks. Is that and have we added people to that? Or are we just moving some of the pieces over at this point? And what might be next? What can we expect here?
So we haven't added individuals yet. Right now, I am working, of course, on a budget presentation and everything for the board, the council, as well as a review of what that would look like. I do hope to hire social workers. Obviously, I think it's important to have that lead on these teams. The Homeless Services Division it needs to be in that social service realm with us, right? There's a lot of work we need to be doing with our homeless, and especially coordinating services to the point where it's not piecemealed. I just met with, many advocates in the last few weeks. In fact, I think to date now I'm over 75 meetings in the community. And the one thing I do keep hearing is I'm not usually at the table. I'm not always up to date on what's going on. So one of those goals with homelessness, I think, is getting especially providers and outreach workers all working together. The Office of Violence Prevention, we're seeing it right now. Anybody living in the city? I live in the city. I share openly. My first grandchild's about to be born. And, I want, thank you. I'm excited. But the reality is my grandson's going to be raised in this great city of Sacramento, and the city needs to be great for everyone, right? The gaps are not acceptable to me. And so we need to find a way to close those gaps. And I do think Office of Violence Prevention, we're all seeing a lot of our violence right now in our city, whether it's gang related or otherwise, but we have to, one of the goals I'm working with Nicole Clavo now is how do we also reach the youth, right? Not that they're
say who Nicole is for folks.
Pardon? Oh, Nicole Clavo is our manager over the Office of Violence Prevention. Dr. Nicole Clavo, amazing human being, has a lot of lived experience around violence and the experience of losing her son. So I think that when
has been there for about the same time as you, right?
Yes, yeah. She came in about a week after I did. So, we're hoping to kind of shift where we're heading in that direction. But I have to say that when we're talking earlier, Jay, about youth, and one of those areas I'm so passionate about is, right now we're all experiencing COVID, right? We're experiencing the idea of lockdown. Online education, the idea of not having that social emotional contact that I might have in a school setting on a regular basis. A lot of the contact, the food regularity or some of that, right? It's so crucial. And I just think right now, this office, especially around youth engagement, couldn't come at a better time for what we need to be doing for our families and our kids.
So let's go back for a second. Then I absolutely want to talk about young people and what we can do for them. But what do you see as other functions of the department as you start to fill it out? And I know there's a lot of work to do. And again, we want to be thoughtful about it. We want to do it incrementally so that people don't fall through the gaps along the way, and respect all of our employees and what they're currently doing and what they want to do. So this is not an easy thing, and change is hard for people. And this is a significant change in how we do business. But what do you see is coming up next?
So I think next for me is as we're working forward is not only looking at those calls for service, but we're starting to look at, should we be, where are we in the collaborative framework of directing or at least being the collaborative lead for services with citywide? You spoke earlier in your introduction about social services are not a normal city function. But the reality is that in today's world, right, it's become a point where we have to do something to provide the services and connections. So a couple of things are happening, really looking at calls for service. And I talked earlier about a lot of mental health and homelessness, but again, any juvenile related calls for service, school related calls for service. When we get back onto campuses, as a former school administrator, that idea, if a student has a fight or there's some other issue on campus, having a mediation team come in that can support them and get services, connections, and resources to the family beyond school, right, will be much more beneficial long-term for that child than maybe that contact. And so, but that's administration, right? We have to shift that as administrators about who we rely on to get our supports. So we'll be looking at that. So family and youth calls for service, neighborhood disturbances. I think many of those really come under more of a Office of Community Response model. I talked earlier at a couple other meetings, and I think in the city council about, if code enforcement comes out because of a violation on your, let's say, your private property or your home, might that not be a better collaboration between code enforcement and myself or a social worker to come out to get you connected to the resources to fix the issue versus having that also be a law enforcement or some kind of penalty level phase. So we're moving that way with calls for service. We are looking at, I've had amazing outreach by a lot of our young new social workers in this community. And I am also a part-time professor at Sac State, but I've been overseeing social work interns for almost 18 years. I am passionate about getting our young people involved on the ground floor up. And I've had this amazing opportunity. I just had a couple more reach out. We're talking young master level social workers who are living in this community and saying, I want to be on the ground floor of this. How do we make this happen for the city? So one of the things we're looking at is a lot more internships and collaboration around young people. But my real goal is to get us down into the high school. So we're bringing those young people in. And then also recently we, with some of our CARES funding, Jay, as you know, we were able to fund a family mental health youth grant for a short period of time. That is a collaborative effort to respond, non-police, to respond to youth and families struggling with mental health and issues related to COVID right now, lockdowns or this ability to the non-ability to get to schools and some of our services. So I think that's going to be a perfect example of how we can work collaboratively with multiple agencies in one city, meaning nonprofits who are all working together to respond to the whole family dynamic and system, not just the one individual in crisis.
No, that's great. One other initiative that's going on, I don't think you're aware of, that I've been working on and meeting with the county and county superintendent and others, is to create a youth mental health board.
Love it.
That would work in the county. The city would be a part of that as a steering committee. And part of my responsibility was reach out to you and tell you what's going on. Peter Bielenson has been very involved. Ryan Quist has been involved. Dave Gordon, Bina Lefkowitz, who serves on the county board of education, has been involved with the project that you were talking about around peer-to-peer teen mental health.
Yep.
I mean, we know, and this is just an amazing data point, through youth surveys, 65% of young people did not know who to call if they had a mental health problem. Yes. And about the same amount said if they were going to call someone, they wanted it to be a peer. So that gives us some very explicit direction. And if we're smart, we listen to these young people, because it will only make the programs that we do more successful.
And I appreciate that in that collaborative that we're going to be working through with Hope Cooperative, Brother to Brother NAMI, and Impact SAC for the next few months. We're going to be training peers on how to respond to mental health, right? How to be that peer response and create call line. And so I think to your point, we're doing some good things. And, we have to be engaged with our youth, especially now. The long-term consequences of some of this trauma that they're experiencing, just not going to school with the COVID situation, will be with us for a while. And our job is to make sure our children and our young people are in good spaces as we move forward, and that they have the support they need.
So I would say, hence the need to redefine public safety. Right?
Yes. Yeah, exactly. And I love that about, the point too, that was one of the things when a lot of these younger social workers and started reaching out to me and saying, I want to be on the ground floor of this. That actually, Jay, in all honesty, just made me so excited, because, you and I won't be doing this forever. And the reality is, if we want it to be successful in 20 years, listening to the people, especially our young people, from whether they're, 9 or 10 or 20, having that input of where they want the city to be in 10 years, what their buy-in, where they're going, and their support and need is very different than when I was younger, possibly, or you. So understanding the curve of that. Plus, as you know, our young people in particular, I love listening to some of these groups we're working with this grant funding, just their ideas of social media and outreach, right? That I'm far enough removed from running a high school campus at this point that it just blows my mind. I'm like, oh, I never would have thought of that. That's awesome. How do we get it going? So
Yeah.
it's exciting.
Well, and in Law and Ledge, we heard yesterday, I have so many meetings. I think it was in
Yeah.
that, they were having trouble getting young people to show up for court cases.
Yes.
And they asked the kids, and the kids said, why don't you just text us? And that's been the answer. So, if we're smart, we listen to these young people, and they're so impressive.
Yes.
And what we shouldn't be, and this has always been my metric as we've done like our Summer at City Hall program and had kids come in and testify before us. But when we're no longer surprised at how articulate and well thought out they are, then we'll have succeeded, because these young people are just fabulous. They have tools that we never could have imagined when we were young people. And I think they've learned how to use them incredibly well.
Right. They're often our best, they're also our best lead on the resiliency, right? The resiliency and the ability to look at a situation from a completely different lens than I have or you have. It's essential that we're giving them the voice and the platform, because that's how we will move forward. And even in our social environment right now, right, we have to be listening to the youth. The youth are telling us exactly where we're going to be in 5 years, 10 years, 15, if we don't listen.
Well, and somebody's going to have to take care of you and me, right?
Yeah, exactly.
Definitely. All right. And anything else you want to say about the youth aspect of your job? How do you see that fitting in? I mean, we've done a lot more programming. We've done some good policy work around young people. I think we have a long way to go, I'm so excited that you're there. I can't even begin to tell you, because everything you've said, from how we deal with young people to working with our community-based organizations who are much closer to the ground in their community, and they know what's needed. But anything you want to add about young people and how you envision working with our YPC, our Department of Youth, or how we're going to work with other community organizations on this?
Yeah. So on the community organizations, if you're listening and you are a community organization today, send me an email. I want you at the table. Everybody has a place at this table. Youth-wise, I honestly want to put a youth peer on every response team. That's really my goal, Jay. I think if we can have youth fully engaged and a part of that process of responding and understanding the need of the community and having that lived experience as a youth. I know as a prior teen mom, I was homeless with a couple of my youngest two at some point as well. And I got to tell you, having that connection with somebody who was maybe 18 and had a baby or had experienced what I had experienced, what would have been extremely beneficial for me. And I just really think they need to be on the teams at the table. So my goal is to incorporate them as much as possible into the actual long-term process of not only this department, but our response models.
That's fabulous. Just, all right, last question, and then I got to jump on a transportation authority.
Another meeting. Yeah.
Yes, it never ends. So if we could switch places and you had 4 votes in your pocket, you were sitting on the council, you got one thing that you could do, what would it be?
One thing I could do, man, Jay, you're making it hard. Yeah. I think I would actually, I would really like to see the ability for young people. I know we're working on it, but I'd love full out internet access everywhere. Free access to transportation, which I know we work on, but it's not as full as it should be. And then I think we should be doing food availability at a really high rate everywhere. I should be able to go to my corner and get myself a box of fresh fruit today.
No, that's great. That's great. I am so excited that you are there. I'm very much looking forward to working with you, and anything that my staff can do to be supportive. We have some pretty smart folks around these issues as well. I know you work with Claudia and some of the work. She'll be back in touch. And Allison, Hillary, and Jasleen, and Yuli as well. We're in it for the long run on this issue, and really want to work with you, and excited that you're there.
Great. So, thanks for having me, Jay. I appreciate it.
No, my pleasure. Thanks very much. And next week, we will actually be doing this remotely, even further remotely. We're going to be going to Oakland to visit Planting Justice, which is the group that we have contracted with to take over the tree nursery that we have in Sacramento by Executive Airport. And their vision of it has a lot of pieces of the puzzle, but community education, growing things, being part of that community. So we're going to drive down there, take a look at what they have in Oakland as an example, and then we'll broadcast with them from there. So we'll see how that one goes. That'll be a first for us. Bridgette, thank you so much. Stay safe, stay healthy, and have a great day.